The last 5 months have probably been the hardest months of my life, but now I really couldn't be happier. I am currently 5 months pregnant and I do have Parkinson's disease. Parkinson's is a incurable degenerative brain disease that affects your motor function, among other things, as it progresses. Last year, I saw a neurologist that basically was like, I really recommend you do genetic testing to see if you have a genetic form of Parkinson's and make sure you don't have an aggressive one. But at that appointment, she basically was like, if you want to be a mom, don't wait for the results of those tests, start trying now. And I guess you could say I took her advice. Once I found out I was pregnant, I reached out to a new neurologist because just a personal preference. And thankfully I was able to get in to see her, my new neurologist. She was really knowledgeable about the Parkinson's medications that are safe for pregnancy. The one I was on, which was the Nupro patch, was not safe for pregnancy. So within like the first week that I found out I was pregnant, I was off that medication and I transitioned from that medication to carbidopa, levodopa, brand name called Cinemet or something like that for my Parkinson's management. There was a part of me that wondered, like, could I possibly go without medication during this pregnancy? When I stopped the patch, it took about 24 hours for me to get my new medication, so I was unmedicated for about 24 hours. And then it took a while for the new medication to start. During that time, I was shockingly disabled in a way that I hadn't seen in myself before because I'd always been on a medication. It was shocking. I couldn't sit in a chair at all, for any length of time. I really couldn't walk very safely. It didn't seem safe or even doable, which also answered my question, can I be unmedicated to breastfeed? That answer is no. I would not be able to safely hold an infant without being on Parkinson's medication. So it's safe to say I have to think about things maybe a little differently than other moms, but something I have learned is that pregnancy comes for us all, okay? It doesn't matter if you have Parkinson's or any other, chronic illness. Pregnancy is hard. It's been hard for me. I am not comparing myself to anyone. Blessed be anyone who experiences pregnancy, because the truth is, it is just gnarly. It is gnarly and is not for the faint of heart. I spent the first 4.5 months of my pregnancy horizontal or hunched over a toilet. I just experienced so much nausea. I realized a part of that might have been because of the Parkinson's medication. I actually really struggled to eat enough my first trimester. I lost weight my first trimester. And so eventually I talked to my neurologist and I was like, can I try going down half the dose to see if it helps my nausea, because it was becoming unmanageable, unsustainable. And my neurologist said, yes, try it, see if it helps. So now I'm on half of the dose I was on originally, and I'm still having adequate management of my symptoms. I will say on the higher dose, my symptoms were gone. I pretty much did not notice them at all. On the lower dose, I noticed some tremors here and there. I noticed a little bit of a foot drag in my left foot, but it's nothing that I can't handle, and it's still very comfortable. I almost never think about my Parkinson's now. That's been such a joy, but it's a joy I didn't appreciate until 2 weeks ago because I've been so sick. But now that I'm out of my first trimester, I get to the fun part of pregnancy for me, which is the excitement. When you're hunched over a toilet, gasping for breath, you're not thinking about I'm gonna be a mom. But now I am, and I couldn't be more excited. I'm starting to think about things like the nursery and baby registries. And with that comes more thinking about what is it gonna be like to be a mom with Parkinson's. I was just talking to someone that's close to me. She just had a baby, and she was saying that she spends most of her time just seated with the baby on her, first few months. That made me nervous because sitting in one spot, I can do it for a video, and that's because I cut around all the times I'm wiggling and readjusting. And yes, the medications help with that a little bit, but I don't know if I'll be able to comfortably just sit with a baby on me for hours. And I kind of had a little bit of a moment of oh no, what is this gonna be like? Will I be successful? And she was like, maybe you'll be just a baby wearing mom. Because for me and for many people with Parkinson's, movement is where you find a lot of relief. So being able to move around my house while wearing baby, hopefully baby is amenable to that. It will really just have to wait and see. There's a lot of what ifs when I think about motherhood and my Parkinson's. And it's not giving me a lot of anxiety, but it is impossible for me not to be just really aware that it might look different than like the moms that I know in my life. I'm okay with that. I guess I'm just like, I hope that the baby's okay with it. As far as I can tell, as long as baby is fed, housed, loved, nurtured, everything else can be a little bit flexible. Speaking of flexibility, pregnancy has really sort of rocked my Parkinson's management. The biggest things I did to manage my Parkinson's before were the patch, I'm on pills now, rigorous exercise, and a special low-carb, like keto-adjacent diet. That diet is no more, long gone. I was so ill in my first trimester that I basically survived off of Eggo waffles and Cheerios. That is not a joke. Eggo waffles and Cheerios is what grew this baby's spinal cord. And I talked to my OB and she was really like, anything you can get down is good for you and the baby. It really is just like you have to survive any way you can. So I really had to be flexible with my diet. Like I pretty much don't follow a low carb keto diet in any capacity now. It's really more about what can I tolerate, what sounds good, like to eat. That's just what I've been eating. And then of course with that first trimester, I was horizontal almost the whole time. I mean, my husband and I started referring to me as a rotisserie chicken because all I would do is lie on one side of the bed and then turn and lie on the other. So I've really lost that exercise routine, but I'm starting to build it back and I'm excited to make a couple of videos to show exactly how I'm doing it. This was really just a quick update video and just to say hi and that I'm still here. If you're new, my name's Natalie, I have Parkinson's and I'm now pregnant. So if you're interested in knowing what it's like being pregnant and motherhood with a chronic illness like Parkinson's, stick around. For those of you who've been here already, I miss y'all, I'm happy to be back and hopefully I'll see you soon. Bye.